I'm Dr. Kerry Spitzer. Today I'd like to share with you findings from a study I conducted with colleagues at the Institute of Healthcare Delivery and Population Science at the University of Massachusetts Medical School at Bay State Medical Center. Each year in the United States, over 1.5 million individuals visit the emergency department, and another 700,000 are hospitalized for an exacerbation of chronic obstructive pulmonary disease, or COPD. Pulmonary rehabilitation is an exercise therapy and self-management program for people with COPD that has been shown to reduce readmissions and improve quality of life. Current guidelines recommend that individuals hospitalized for COPD begin pulmonary rehabilitation within 3 to 4 weeks after discharge. However, we know that far too few people ever end up receiving pulmonary rehabilitation. To better understand why so few individuals participate in pulmonary rehabilitation, we wanted to talk to hospitalized patients to understand their perceptions of the barriers and facilitators to enrolling in this program. We conducted semi-structured interviews with patients during a hospitalization for COPD in a large teaching hospital in the Northeast. In total, we interviewed 15 patients, 9 of whom had prior experience with pulmonary rehabilitation. We used directed content analysis to identify key themes that arose from the interviews. We found that facilitators of enrollment included a desire to learn more about the disease, strong social support, and trust in the healthcare provider recommending pulmonary rehabilitation. The desire to learn more about COPD was a common theme and one that is extremely relevant due to the educational component of pulmonary rehabilitation.
Nobody is really giving me information on it. I don't know what to expect. I didn't know I was going to get worse.
Those who successfully enrolled in pulmonary rehabilitation often cited the role of a trusted healthcare provider in motivating them.
I love my pulmonologist. I would stand on my head for him.
A social support network often provided both emotional support and practical assistance with appointments.
I got 9 brothers and a mean mama. If I don't go to rehab and do the things that the doctor recommends, I'm going to hear it to the end of the moon.
On the flip side, family obligations could make it hard to attend.
But when it gets too close to like 3 o'clock in the afternoon, I can't because I know my granddaughter is coming out of school.
Additional barriers to enrollment included lack of awareness, lack of motivation, and problems with transportation. And are you familiar with the idea of pulmonary rehabilitation?
No, I have no idea what it is. No.
Many who had attended had to overcome a lack of motivation.
It took me a lot to go the first time. I thought it was going to be a pain in the ass. Who wants to exercise? I can't breathe.
But once PR started, many described a positive feedback loop where feeling better and social connections with the staff and other participants kept them coming back.
It gave you a little bit of life, a little bit of stamina, more than you could feel. Like, all right, I can go up and walk down to the corner today.
For some, PR provided a renewed sense of hope.
Well, you learn things, you laugh a little bit, you exercise, and you leave there feeling part of something, which sometimes means a lot.
Unfortunately, several found it difficult to sustain because of illness.
I did participate in pulmonary rehab, but then I just wasn't feeling good and I ended up in the hospital again.
Our results highlight the importance of increasing awareness of pulmonary rehabilitation and building trust between provider and patient to facilitate initial enrollment. Future interventions to improve enrollment and adherence should address the need for education about the benefits of pulmonary rehabilitation and the value of social support. Thank you for listening, and I encourage you to read the full report.